Did you know that intense pulsed light, or IPL, is one of the most powerful tools we have to combat chronic dry eye? But there is a variable that can influence how effective the treatment could be, and it all comes down to what covers your eyes during the procedure. Welcome to Dry Eye Explained. I'm Dr. Wilson, OD and expert in dry eye and ocular surface disease. If you're struggling with discomfort or looking for real solutions, you're in the right place. For everything dry eye related, be sure to visit our website, dryeexplained.blog. And if you're ready to take complete control of your eye health, check out our eBook, a comprehensive, step-by-step guide to understanding, managing, and treating dry eye. Today we are breaking down that exact variable, the different types of eye protection used during IPL, corneal shields, disposable stickers, and goggles. Let's explore why your eye protection can impact your results. To understand why eye protection matters so much during an IPL session, we first have to understand what we are actually treating. The vast majority of dry eye disease is caused by MGD, Meibomian Gland Dysfunction. Your meibomian glands are tiny, vertical oil-producing structures lining both your upper and lower eyelids. Every time you blink, they are supposed to secrete a thin layer of clear oil that coats your tear film and prevents your tears from evaporating. However, when you have MGD, chronic inflammation causes these glands to become blocked. The oil turns from a clear liquid into thick, stagnant toothpaste. Over time, the glands can die off and disappear completely. This is where the IPL comes into play. There are a handful of IPL devices available used to treat MGD, but today we'll be focusing on the Lumenis OptiLight device. OptiLight is specifically FDA approved for dry eye management. It uses precisely calibrated bursts of broad-spectrum light, where this light energy is absorbed by abnormal, inflamed blood vessels surrounding your eyes. These are the tiny vessels leaking inflammatory markers directly into your Meibomian glands. The light gently heats and destroys these abnormal vessels, which shuts down the inflammatory cascade. At the same time, the thermal energy warms the stagnant meibum inside your lids, melting that thick oil so it can be expressed. IPL also helps to eliminate microscopic demodex mites that live on the lash line. But here is the catch. To get these incredible benefits, the light energy has to be applied directly where the problem is. The closer we can get the OptiLight light to your actual lash line and the meibomian glands, the more effective the treatment will be. And how close we can safely get depends entirely on how we protect your eyes. When performing OptiLight IPL, safety is paramount, but your doctor's choice of protection can impact your clinical outcome. Let's compare the three main options: goggles, external sticker shields, and internal corneal shields. First, traditional laser goggles. These goggles sit over the entire eye socket and can be made from silicone or stainless steel. They are non-invasive and perfectly comfortable. However, because they cover the whole orbital area, they can block the practitioner from treating the eyelids. We can only treat above the cheeks. This limits the impact on the meibomian glands since the light energy cannot reach or cannot get close enough to the lid margin where the inflammation is centered. Second, disposable shield stickers. These opaque adhesive patches are placed directly over closed eyelids. They allow the practitioner to get closer than goggles. With smaller stickers, or by maneuvering its position, the upper eyelids can also be treated in a limited way. The eyelashes and eyelash follicles are covered and protected. However, stickers still cover the eyelashes and lid margin. So as a result, we cannot treat the upper eyelids super effectively, or the actual meibomian gland orifices super closely. Also, if the adhesive lifts slightly over facial contours, light may leak underneath. They are a middle ground approach that falls short of complete targeted glandular treatment. Third, the gold standard for dry eye IPL, internal corneal shields. These smooth, medical-grade, stainless steel or silicone caps are shaped like large contact lenses. After a numbing drop, we safely slide the shield under your eyelids directly over the globe of the eye. They block 100% of light while leaving your entire upper and lower eyelids fully exposed. This allows the OptiLight light to be applied directly over the Meibomian glands, right up to the lash line on both upper and lower lids. Treating directly over the glands destroys the inflammatory vessels and melts the meibum directly at the source, making the procedure vastly more effective. However, some patients find it intimidating, especially those with sensitive eyes or people who don't want contact lenses. It also requires use of anesthetic eye drops. So what do the experts in the field say? This has been and is still a topic of hot debate. Dr. Rolando Toyos, the founder of IPL for dry eye, does not advocate for the use of metal shields. He states that the metal shields will irritate the fragile corneal nerves of dry eye patients, with concerns of corneal abrasions and increased inflammation. His specific FDA-approved Toyos protocol relies on external sticker shields. However, there are many other well-respected dry eye specialists, such as Dr. Laura Perriman, who do successfully and safely treat patients with metal shields. In our practice, we do also use the metal shields for majority of our patients. To summarize, while goggles and stickers offer convenience, we believe internal corneal shields are the absolute best way to ensure your IPL treatment effectively targets your Meibomian glands. However, if you find it a bit confronting, it is absolutely fine to try the other options first. Always consult your local eye care professional to discuss the best options and treatments tailored to you. If this was helpful, keep your eyes on our channel. Please hit like, subscribe for more evidence-based tips, and leave your questions about IPL in the comments below. Visit our website for more information, and while you're there, consider grabbing a copy of our ebook, your complete comprehensive guide to understanding, managing, and treating dry eye. Thank you for watching, and see you in the next video.